My name is Bagasha Peace. I'm a medical doctor. I'm from Uganda. I work in Mulago Hospital, and I work with the nephrology department. So the nephrology department is basically people who take care of any kind of kidney disease. You imagine in Canada, for example, so 1 in every 4 people who have diabetes will end up with kidney disease. Yeah. So and diabetes is like huge. Like so many people have diabetes. So in Uganda, we have not only diabetes and hypertension because those are lifestyle illnesses. We have those, but then we also have a lot of infections, a lot of HIV. Uganda is like one of the top countries when it comes to HIV, like pandemic. So HIV infections, and then on top of that, there's like out of a population. So Uganda has a population of 34 million, which is the same as Canada itself, and it's just the size of like 4 Ugandas will fit in Ontario. So Uganda is really small. It has that much population and that much density. So for a population of 34 million, we only have 4 nephrologists. So nephrologists are the doctors who treat like kidney disease, and there's only like 4. So even if it was small number of patients compared to Canada, still the numbers are really, really overwhelming for the 4 doctors who are looking after the kidneys. So it's a huge, huge, huge problem for us. The fact that there are very few patients who come, because I do the nephrology clinic, and well, nephrology is almost like a death sentence for us. Like if a patient has end-stage kidney disease, it's almost like a death sentence. They have to pay. The difference is that they have to pay all their bills, all their medical bills. You know, Canadians, you're really lucky. Your government pays for you. You know, so for us, they have to pay for dialysis. Dialysis is really expensive, and they have to pay for dialysis. So for many of the patients, it's like a death sentence, really. And the fact that there's no doctors to really help them through it makes it, I think, even worse. So we actually have a lot of Ugandans who are doctors, but the problem in Uganda is that the pay is not too good. So many of them, once they get their medical degrees and they realize that they're not getting so much pay, they will leave Uganda and go to other countries to work in other countries. They will come to Canada, they will go to Australia, they will go to, you know, other places where they can get better pay. So that is always a very bad, like, thing that happens. Most importantly for me, the thing that I'm going to take back the most is the fact that learning that, you know, even if you have very many resources, there's still so much more you can do. And many of the things that we are doing here, we can still do in Uganda, yeah, despite the resource limitations. So there's still actually a lot that I'm actually going to be able to take back home. Yeah, simple things that you guys are doing, which can actually be applied without thinking about resource limitations. So it's actually a lot. So when I get back, I think the most important thing is I'm going to be teaching, because that's the whole idea. You know, make sure we have much more nephrologists. I mean, me alone treating all the patients will not do anything, but I have to make sure I teach as many people as possible, such that, you know, the workload even for me will not be that much.